lot of upbeat bumper music right there. I like that. Last one was all whistly. This one sounds, I don't know, energetic maybe. Dr. Sharla Patterson is on the phone. Dr. Patterson is a breast surgeon with NCH Physician Group in Naples, Florida, one of my favorite cities in this state. She serves on the national and state level committees and has received numerous awards for her commitment to breast health. She's got something called the BioZorb marker she wants to talk to us about. It's described on my notes anyway as a GPS for breast cancer that ensures more precise radiation treatments for breast cancer and minimizes side effects. Every time every day that goes by, I think we get a little bit closer to being able to say goodbye to that whole word cancer, right? It's going to be it's going to be history soon, right? Dr. Sharla Patterson, good morning. It's an honor to have you on the show.
Thank you for having me. Good morning.
Good morning. Are you in Naples right now?
I am, and it's beautiful, sunny, palm trees.
It is beautiful. Really. Don't tell the people here. I mean, we got a pretty city here, too, but I like Naples.
You do. Yeah. We frequent Orlando area very often.
So what is BioZorb? What is that?
So BioZorb, it's a teeny tiny little simple device that's just had a huge impact on how we treat breast cancer and do breast cancer surgery. We used to treat all women who had breast cancer. We said, you got to have a mastectomy, you got to have your breast removed. We learned better, we got smarter, and we figured out that we can do a lumpectomy, which is just taking that lump of cancer out of your breast. And the reason that we were able to do that is technology of radiation therapy. What radiation therapy does is it helps us treat the breast cancer and is an effective way to reduce the risk of breast cancer recurring or coming back after surgery. Okay. So we know now that we can cure your breast cancer exactly the same if we do a lumpectomy and radiation or if we did the big mastectomy. But obviously they're going to look different. So the woman is empowered to make a choice, a good choice. Both of those are good choices.
So how long has this been around?
The BioZorb's been around, my knowledge, I've been using it for about 5 or 6 years. Had really good practice with it. And what it is it's an implantable device that I put in at the time of my surgery. When I do the lumpectomy, I know exactly where the cancer is because that's my job to get it out. So when I take it out, I put in this little implantable device, which actually looks like a small spiral of plastic, but it's actually made out of suture material. So it's the same suture that we're using to do the surgery anyway. And I know where that tumor was, so I stick this little thing in there, and like you said, it's like a GPS for the breast cancer. We all know exactly where it was. The goal with surgery is to get it out so that nobody knows where it is, but our radiation doctors have to know so that they can target their radiation in that area. And so that's what the BioZorb does.
Obviously, it's going to be impossible to explain it to us in the course of a little interview like this, but I'm glad that it's there. I think that's the way I feel about it. I'm glad there's progress and there's hope. It's what it sounds like to me.
Very much so, very much so. And with breast cancer, because it is such a sensitive area, we're very used to women with breast tissue that look a certain way. You've lived with breast your whole life. So in enhancing that empowerment to keep that feminine shape and that bosom shape and to wear the clothes that you want to wear, it's huge. And, living life in a quality way is a big thing in breast cancer. And the BioZorb helps us do that.
Mm-hmm. Sometimes young women are diagnosed and they're in their late teens. Is this safe for them?
This is safe. As I said, it's a small implantable device, and it's made of suture. So there's nothing that's radioactive. There's nothing that's a foreign body. It's the same suture that we would use to do your surgery. So it's safe for all ages.
Does it stay in there once you're done with the surgery? Is it dissolved by itself?
So just like any suture material, it will be in there, and your body does break it down, and you'll form some scar tissue around it. So there's no need to have another surgery to take it out or to remove it. No precautions when you go through TSA. You're not going to set off the alarm at the grocery store. Nobody's going to know about this. So there's no need to have anything else done to remove it or take care of it.
So how long does it take before you feel comfortable inserting it?
As far as the surgeon, so the first few times that I used it, it made sense. It's very well made in that it's three-dimensional. So surgeons think very three-dimensional because that's the line of work that we do, and it's very surgeon easy to put that in. So from the first few times I used it, it made sense, and the adoption rate of other surgeons using it have been very similar to my experience, that it's very facile to use, and it goes along with surgical techniques that we're all trained in, and very easy to adopt.
Has there been any rejection by the body?
I have had zero. Again, because it's suture material, it's the same, and I don't have patients that their stitches fall out, so it's the same. It's very inert, and no rejection that I've had.
So when you talk about using it, does a woman have to qualify for it? Does it follow that same rule that the sooner the better?
Yeah, so the sooner the better, and that's why we advise mammograms. Talk to your doctor about, the age that you need to start, because it's different for everybody. But as soon as we find this breast cancer, we want to take it out of your body. And a lumpectomy is a good option for almost all women. So the beauty of the BioZorb is that it's available for any woman who's been diagnosed with breast cancer that is going to have a lumpectomy. The women having a lumpectomy will benefit most from this treatment. And the bottom line is BioZorb can help breast cancer patients have a better cosmetic outcome and can help them with better radiation targeting.
Is it applicable to other cancers elsewhere in the body?
It hasn't been used for anything outside of the body, so I don't think so yet.
Okay.
And are all breast cancer surgeons aware of this? Or do we have to ask for it?
Yeah, I can't speak for everybody, but information disseminates slowly, and so programs like this helping raise awareness. Women being empowered to know to ask for this is a big way that we can advance our health care, and I would say if my mom was in a surgeon's office, I would have her ask for this.
Oh, really? Okay. And that's always surprising to us because we always feel like they must know, right? So we always feel, and we're always intimidated, I think, by our doctors. So we feel weird asking for something we heard about on the radio. But in this case, you ask for it by name? Do you call it?
Yep. The BioZorb, and there's lots of clinical data. So in the doctor journals and the doctor books, they would be able to look it up. So going beyond, the Facebook, YouTube, radio education, there is clinical science that the doctors can have access to and read about it, and it makes sense. I think once the data is in front of them, they can make a very good informed decision.
And the attitude of the patient is everything. So if they are able to have this type of treatment and not have to have the mastectomy, the battle is halfway won. This is amazing.
It's huge for women. It changes lives. It's so empowering for women to have this option.
Do you have a website so that we can educate ourselves a little further?
Of course we do. The website is mybiozorb.com.
Okay, mybiozorb.com. I just want to make sure I don't have the wrong thing on the site here. I have Hologic. Is that the same thing?
That is where it comes from, so it's our parent company.
Oh, okay. So that's okay. I have it on the screen right now. I want to make sure it's good.
And how did you yourself find out about this?
So I learned about it. I was reading about it in some of our materials that came out, and then every year we have a national meeting for the American Society of Breast Surgeons, and we all come together and talk about things. And there's data, and you talk to other people, and so I brought it into the practice, and it's been fantastic, and I won't turn back from it.
Well, you're a blessing to your patients.
Well, any step we can get closer to being able to say that we don't need to worry about cancer anymore is always a good step. And at least at this point, if you do get diagnosed, at least there's a way to come out of it looking good and feeling better. And thank you for the work you do, Doctor.
Thank you so much. Thanks for having me. You guys have a good morning.
Thank you. You too. We'll be right back.